Hey everyone! Ever felt constantly tired, bloated, or low on iron? Think it's just stress or a poor diet? Well, what if I told you it might be something else entirely? We are talking about Coeliac disease, an immune-mediated disorder that affects about 1% of the global population. Picture this. A simple meal, like toast or pasta, could be quietly triggering an autoimmune response in your body. This isn't a food allergy, it's Coeliac disease. It damages your small intestine, impairs nutrient absorption, and increases your risk of complications like anemia, osteoporosis, and even certain cancers. The kicker? Up to 80% of cases remain undiagnosed because the symptoms are often mistaken for other issues. Let's break it down. Gastrointestinal symptoms include diarrhea or constipation, abdominal bloating and pain, nausea, vomiting, foul-smelling stools, and unexplained weight changes. But it doesn't stop there. Beyond digestion, many people experience chronic fatigue, iron deficiency anemia, headaches, mouth ulcers, joint or bone pain, and a painful, itchy skin rash called dermatitis herpetiformis. It can even affect your brain, causing depression, anxiety, or balance issues. In children, it's even worse. Poor growth, delayed puberty, and constant irritability. And here's the tricky part. Some people have no symptoms at all. This is called silent coeliac disease, but the internal damage is still happening, raising the risk of long-term complications like osteoporosis, infertility, and even intestinal cancers. So, how do you get diagnosed? It isn't based on symptoms alone. Doctors rely on blood tests to detect specific antibodies and confirm it with a small bowel biopsy. Shockingly, many people wait up to 10 years before getting diagnosed. And what's the treatment? There's no pill. The only effective solution is a strict, lifelong gluten-free diet. But here's the good news. Once gluten is removed, the gut begins to heal, symptoms improve, and people start to feel like themselves again. Think you or someone you know might have coeliac disease? Don't ignore the signs. Talk to your doctor and ask for a test. This video is for educational purposes only. Always consult a healthcare professional for medical advice. Like, share, and subscribe if you want more science-based health content that actually teaches you something. Thanks for watching, and take care.